Hi, everybody. I'm really excited to join you today and also to talk about some of the serious things that are going on with the pandemic that all of us are in at the same time globally, and certainly in the United States, we're going through a rough spell with it these days. And I just wanted to access some folks that are working with this or have worked with similar situations in the past. And I'm so grateful that Scott Whipple's joining us today. He's in New York, in the epicenter for the United States and one of the more difficult places in the world right now. And he lives there and works there, and we're hoping he'll move to Boulder at some point out where I live. We're coaxing him out here eventually. But he's a licensed certified social worker, and he's in practice in New York City. He's also an associate professor in the Silver School of Social Work at NYU. He's been on the faculty for 15 years. He's a former director of mental health and social services at Callan Lord Community Center in Manhattan and former director of intake and assessment at Gay Men's Health Crisis. He's also a lead assistant for SETI, Somatic Experiencing Training Institute, that I've been associated with for a long time as well. And he's a certified senior consultant. Scott worked really extensively with people in the HIV AIDS pandemic, and he's worked deeply with the LGBTQ community. So he has a very important perspective to add for us today. And he's specialized in working with survivors of trauma for over 15 years. So he's really been in the trenches. He was there during 9/11 when all that came down, and we talked about that long ago. So we've been through some challenging times together. Scott is a dedicated member of the SE community as well, so we have a connection through that. And he's presented at the International Men's Survivors Conference and the International Conference on Diversity in Organizations, Communities, and Nations, both in Granada, Spain, one of my favorite places, and Toronto, Canada. So gosh, Scott, thanks for taking time out of your day to check in with us about really these big challenges we're all facing as therapists and as human beings, because we're in the same activating experience that our clients are also in all at the same time, which is often not our usual circumstance. So how are you doing there in New York, and what might you want to tell us a little bit about what's happening there? And then I would love to talk to you a little bit about your experience and what lessons you learned or how you were able to be helpful during the HIV AIDS pandemic.
Hi, Diane. It's great to be here. Great to see you, at least virtually.
Yes.
Things are intense in New York. Things are getting better, which is a relief, but the numbers are still staggering. And as you said, we are in this together. I heard somebody say the other day, we're all in the same storm, but we're not all in the same boat.
That's a really great way to put it.
Which I thought was very helpful, just in terms of, I'm very privileged. I have housing, I have food. I'm able to work remotely. Not everyone is so lucky. Particularly we have such a huge homeless population in New York, and they're just
That's got to be devastating with no water or soap or place to shelter. I can't even imagine.
Yeah, there's a great organization called Backpacks for the Street that is actually out there on the streets with homeless, making sure that they do have food and water and hand sanitizer, and really doing remarkable work.
Oh, I'm so glad.
But yeah, I think there are some unique challenges. As you said, I was here during 9/11, and but that was not an ongoing. I mean, certainly the fallout from that was ongoing, but I think the day-to-day uncertainty is making this very challenging as clinicians that we're sitting with this, and our clients are sitting with this. And I've noticed a lot of this sense from people that I'm not doing this well. I'm not doing self-care.
As if they should know how to,
Right. And I keep saying these are uncharted waters. We've never been through this before. And I think, if you go back to Maslow, we're at the bottom of the pyramid, and just in terms of, water, food, shelter, personal security, employment, we're not at the self-actualization tip of the pyramid. And I think I've heard it from colleagues and clients, put this unrealistic expectation on themselves, like, well, I should be somehow doing this better. And just trying to say, we're figuring it out as we go along, and we're doing the best we can.
And like you said, it's unprecedented. We've never been through this particular challenge. Nobody has. I mean, nobody anywhere. So
There's no rule book. There's there's no guidelines. And it's very hard to forecast. Really is a time for, as many of my clients who are in 12-step talk about, one day at a time, and sometimes it's 1 hour at a time.
Right. Well, the other thing.
Practice.
I'm sorry.
It does feel like a mindfulness practice, just trying to stay in the present moment.
And stay creative when we can, when we're not struggling with too much stress or not sleeping because of it. I know people are having metaphoric dreams that are related to the COVID virus. And I had one last night. I didn't sleep well last night, and I can't remember the details, but I remember waking up going, "Oh, well, that was a virus dream." So I think it's entering in, in all levels of our consciousness right,
and the level of, I think, just emotional and physical fatigue that, as our lives have shifted to be primarily online, people say maybe doing half the amount of work but feeling twice as tired.
Right. There is something about it that's draining. You get headaches. You need to take breaks and pop your head out into the sunshine, or definitely not watch television after being on the computer all day, but just something that gives you some sort of break from the I don't know, machine energy, I guess, of being online so much. How has that affected your work with people? Have you noticed certain challenges working on Zoom or whatever platform you're using?
Well, I've found myself really fatigued. I'm also teaching online, and
so you've got double duty,
which happened very quickly. And our courses weren't really designed to be online courses, so just trying to figure that out as we go along.
I've been talking to some people that are involved in university programs, and they're all just struggling. Because they're trying to convert all these programs kind of simultaneously. And like you said, some of them are labs, and they really don't work with online so easily. So it's a really big challenge on so many levels, on education, therapy. I'm so glad we're able to, like you said, we have the privilege of being able to work online. So that's a real advantage. And then I think you're particularly sensitive to the diversity issues of people that have a lot less advantages, and they can't work, they can't have income, they may not have health care, they sometimes don't even have a place to shelter. So there's just so many levels of society getting hit really hard, and so many less advantaged groups that are really taking the brunt of this. And I know you're seeing that a lot in New York. You mentioned to me that there was the medical personnel are just our nation's heroes right now, but that somebody, ER doctor, had committed suicide recently in New York.
Yes, ER doctor. I think she was at Columbia Presbyterian, if I'm not mistaken. She recently committed suicide. She had the virus and had recovered, but it was just the enormity of the amount of loss, is at least what her family is reporting.
Yeah, it has to be. It's just so hard to see what people are exposed to every day. And we see some of that on the news. I'm not recommending people watch the news too much either, because I think it can be really activating. But, we have to check in just to kind of know what's going on. Maybe just briefly in the morning, briefly at night, or whatever your rhythm wants to be about it. But this is really, really tough. And I'm just really so sorry to hear that.
Well, I know back during the HIV epidemic that you had referenced earlier, my first job out of graduate school as a social work student was working in an inpatient AIDS unit at Cabrini Hospital in New York. There exists. And that was overwhelming. And I remember one week in particular having three patients die in 1 week. And that felt so unbelievably painful. And these frontline medical workers now are seeing multiple deaths daily. So I think the fallout from that is just going to continue. And while I think of it, I do want to mention a resource for all essential workers. It doesn't have to be medical personnel. It can be people who are working in grocery stores, people who are doing delivery, and they need support. It's called coronavirusonlinetherapy.org. It's actually started by Jen Salachi in Boulder, Colorado.
Oh,
And
great. Yay, Jen. I know Jen. That's wonderful.
she's done an amazing job. She and I were just talking about it when I was visiting in the middle of March. And just since then, she has mobilized this. She has licensed therapists in all 50 states who are willing to volunteer for low or no cost therapy for people. So they just have to go to coronavirusonlinetherapy.org. They can sign up, they can get matched with a therapist. They're on their way to getting not-for-profit status. So she's done heroic work in a
Oh,
very short.
that's fantastic. I'm so happy to hear that. And I imagine it's the same website if a therapist wants to volunteer time.
Yes, it is. Thank you
Right.
for mentioning
Mhm.
that. There's also a therapist portal so people can sign up and
So coronavirus online therapy, did I remember
yeah,
that right? Okay.
.org. Yeah.
.org. Okay, great. Wow, that's fantastic. I'm so happy to hear that. I mean, people are doing such creative and innovative, uh, amazing things to help with this. I mean, as we're all struggling with it, and it's just really inspiring to hear things like that, and that she's been able to put that together so quickly. That's really, really beautiful. Really wonderful. Well, when you were working with the AIDS situation, what kept you going? I know you've talked a bit about self-compassion and self-care for the therapist because, again, we're in the same soup as everybody else. And like you said, well, the same sea, the same storm, but having different boats. But I just wondered how were you supported when you were working with the AIDS HIV pandemic?
Well, I think the thing that's different now is that there is public support and public awareness where there wasn't back then. I mean, there was
Hmm.
no response from city, state, federal government. We couldn't get anybody to talk about it, let alone do anything. So the
Right.
fact
So there wasn't even much research in the beginning, or that
that
people
there was
didn't have
nothing,
any idea, and we were afraid of it. And
we
yeah,
didn't know how it was transmitted. There was no test, there was no treatment. Um, Doctors and nurses didn't want to treat people with HIV. There's stories of food being left outside of hospital rooms and staff not wanting to go in. And understandably at the time, because we didn't know that it was transmitted by body fluids, there was
hmm,
that it might be airborne like the coronavirus. So it was very difficult because it felt like you were in the trenches all by yourself, except with your peers who were always also doing the same work. And
right.
wasn't a lot of support.
Wow, that must have been, I can't even imagine how difficult. When I was doing my internship, gosh, I don't know when it was now, early 90s or something. There had been a gentleman that was a grief counselor, he ran grief groups for aid patients, AIDS, families and people that had had the illness. But he had been through so many losses, and we were studying Carl Rogerian work, unconditional positive regard. There's all this really good uh, perspective to that. But they did have the idea that if you weren't feeling the pain of the situation, you weren't actually working. They didn't have the idea of resourcing and then going back in and doing what you could manage and then, taking a break. And then, we didn't know about regulating the nervous system. I mean, Peter Levine was teaching back then, and I was in his courses at the same time I was in graduate school. But this gentleman, he had witnessed over 300 people over 2 or 3 years pass from AIDS, and including 2 or 3 partners of him personally. So he was just in grief, on top of grief, on top of grief, on top of, it was so much grief. And I remember here they have him working with a student in internship, and they're trying to have him just stay with the total pain of that. And I would like, you watching behind the mirror, the window or whatever. I was like going crazy because I thought this is like such a traumatic level of grief. And it's for regular level, a certain level of work, stay with the pain is a good idea. But I just felt like it was such an aberration what he was dealing with. And oh, it really opened up my eyes though to understanding how massive this was, and
Well, and so
um,
much of that grief, I think, was also disenfranchised because
yeah.
I mean, family members weren't allowing partners to come to funerals. There weren't funeral homes that would take AIDS patients.
Oh my gosh.
And, those of us who were working in the field at the time, when I was at Cabrini, I would be working all day. And then after work, I would go and visit my friends who were
Yeah.
in the hospital. And it just felt relentless.
Yeah.
And that went on for years.
It
Uh,
seems like it seemed, and I know they even had a special burial site on an island. I'm trying to remember the name of it, near New York, where they were just even burying bodies separately. There was just all of this fear. And I mean, of course, because I mean, it's understandable. I'm not saying it was wrong, except that it's wrong because there was so little support and so much left to be held by just the community itself, where without any federal support or funding or even that time research, it's just was so much isolation. There's a relationship between what we're going through now. It's different. We have more, we can talk openly about it. We're not refused medical services, but this, to take it to that level, it just is really so painful to even think about that.
yeah, I've always been very interested in someone doing research about those people, those of us, I shouldn't say those people,
Right. Yeah.
I'm one of them, um, who survived all that and just sort of what the ramifications have been in their later life, in their later adulthood.
Is there anything you've noticed for your friends or yourself about that? And are you getting triggers from this pandemic to memories of that pandemic?
I'm glad you brought that up because I think I haven't noticed it so much myself, but I have heard from other friends and colleagues that very much so that this is bringing back that time um, for them and have found it very activating and have been a little surprised at how activating it's been for them, thinking that
Yeah.
that is sort of, but I really don't think there was the time or the space to grieve at that time because it was just, there were so many losses.
Yeah. Well, it's a tremendous thing to have lived through and been close to. And I can imagine some of the isolation and some of the, I guess, kind of seeing other people as dangerous. I mean, I notice even when I go for a walk in beautiful Colorado, it is beautiful. Um, you know, the physical distancing we're all supposed to do, we do, of course, and wear masks and all that. But it's almost like you see other people as potentially, there can be, I can see people react sometimes as if, oh, danger, danger, and another person is on the path. And it'll be interesting to see the outcome of that after this. Eventually, we find that it's coming to a halt, hopefully, at some point, whenever that might be. But like masks used to represent like somebody's going to rob a grocery store, but now masks represent safety, and not having a mask represents danger. So it's interesting to think about like what's going to happen with social engagement because we're used to seeing people's facial expressions. We can see the glint in their eye or the anger in their eye or whatever's happening. Through the eyes, but we are missing this much of the face. So it's an interesting, challenging time for people to really stay in their kindness and presence, and like you said, having a connection to compassion. I know you were talking a little bit about self-compassion and maybe having therapists look at that particular situation for themselves and their clients. Is there more you'd like to say about that?
Well, I just want to follow up on one thing you said before. I think one of the big differences between the HIV epidemic and the current pandemic is that one thing we were able to do was to be with people.
Yeah, you could gather.
It was to sit by a hospital bed and hold somebody's hand, even when there wasn't treatment. And now not being able to do that, and that how that's impacting people who may not be infected with the coronavirus. I'm just thinking about a friend of mine whose father just died, and he was in his 90s, did not die of coronavirus, but his mother couldn't be with his father because of quarantine. So, a lot of the rituals that we have, speaking of social engagement, I went to my first Zoom memorial service.
Right.
The people aren't being able to gather. I have clients who are in the Jewish community who are used to, after death, sitting Shiva for 7 days.
Right.
that can't happen now. All that has to, if it does happen virtually, and that's quite an impact.
I talked to a rabbi last week at Tears of Firestone, and she said she facilitated or attended a 90-person Zoom funeral. And I've had two colleagues that have lost mothers that were in their 90s, and they even knew they wanted to see them. They had trips scheduled to see them because they knew they were kind of going into decline. But of course, that had to be canceled. So they ended up being, no connection. Even the way the funeral was handled at the gravesite, they kept people with masks inside their cars. They were allowed to drive by while the ceremony was happening at the gravesite, or like have their window open to hear what they were saying. But it just it's tough. I mean, really, not everything carries so well on Zoom, and especially our grieving practices. So it's been there's just so many ways to think about the way our lives are different now. And I just keep thinking too, how do we prepare for the post-pandemic? Because it's not just all these mental health concerns aren't just going to evaporate once the ban for connection is lifted. There's a lot of outcome. I read the research from other pandemics, and there tends to be a spike in divorce. There tends to be a spike in depression, PTSD. There's just a lot of things people are kind of holding at bay that are going to probably show up a lot later on, and for a while, probably for quite a while. So I just
first responders and essential workers don't really have the luxury right now.
Right, they're in soldier mode. They just right.
They can't attend to that. So even though we have some great resources out there for people, they may just not be able to take advantage of them right now. That's going to happen later.
Right. So we started to talk a little bit about self-compassion. Was there something that you wanted to give therapists as a focus around that?
I think just in my experience, I've just been trying to, for people that I supervise and also my clients, just trying to normalize this situation because it's so abnormal, and however they're responding is fine.
Mm-hmm.
There is no right way to do this, and
No.
that really having to, as you mentioned earlier, Diane, having to really focus on the self-care and take the breaks and do what you need to do, and that's okay. If you have a break and you need to take a nap, or
Right.
you can have a chance to get out and get a little fresh air, or just not to be so hard on ourselves.
That's really important. Not being so hard on ourselves. I heard somebody interviewed, I can't remember who it was now because I've been listening to a lot of interviews, but they said that they have A days and B days. A days are when they get up and they really feel creative and they're going to like work on a book, or they're going to do something, plant the garden or do something creative. And they have B days where they just feel like can't do a thing, no juice,
Right,
And
and I think that I've had clients talk about, well, I'm on social media and I see people are, baking bread and they're learning a foreign language.
yeah,
And it's like, well, that's great, but not everybody has the wherewithal to do that right now, and that's okay too. It doesn't have to be, again, this moment of self-actualization. It's just we're still in survival mode and we're just trying to get through the day.
I'm really glad to hear you emphasize that message, because I think in our profession, we tend to want to caretake, and we are doing that to the extent we can do it, but there may be times we can't do it. And I talked to a colleague who usually is very active in the trauma world, and she said, if you ask me a question, I might be able to come up with an answer, but if you ask me to write something or be creative any way at all, not going to happen. And usually she's one of the well-known creative people, she's not there. So and really to have this perspective that just like with grief, people grieve in very unique ways. Some people get angry, some people disconnect, some people don't want to be around, some people want to be there and can really be present. There's not a right way to do it. And it's really important that we give ourselves that room, and we also understand that our clients are probably going to be going in a lot of different directions, and our friends and our colleagues and our families. There's just so many different reactions that we want to make space for.
Yeah, I found I've had much more difficulty concentrating. It's taken me twice as long to grade papers. It's hard to get motivated to do it. Again, it's sitting in front of a screen for more time, and
Right.
I'm really having to just chunk that down and just do it in much smaller time frames.
Yeah. Yeah. I've had colleagues that have been international speakers tell me they don't think they ever want to go to an airport again, you know? So it's kind of a weird time. Occasionally you have a space open up where you're sort of reflecting on your priorities of life and what you want to spend your time on once things open up again at some point, you know? Um, and then other days just go by and you feel like nothing happened at all, you know? And that's part of this. It's part of this experience. Is there anything that you find you're doing that seems to be particularly helpful, either personally or what you notice your clients are doing or other friends?
I think I'm just trying to really listen to my body and pay attention to my nervous system and really tune in and not override, because I'm a champion overrider.
Yeah,
Way back.
I could say that about myself too.
And I've been called out on that many times. And I was very fortunate when I first started working in HIV, as was my supervisor at the time had very excellent boundaries. And she said, I know that you're a clean desk kind of guy. And she said, you are never going to catch up.
Mm.
Because when the day was over at 6 o'clock, she said, it's time to go home. And I was always, well, I just have, a couple more things to do. And she's like, no,
Oh, great.
now, because you're not going to be any good to me or anybody else
If you
if
get
you
compassion fatigue or burnout, right?
burn yourself out in 3 months. So I hear her voice in my head a lot, even now, even though that was many, many years ago.
She's a great mentor. It's a little tricky working at home because sometimes things call to you, you know, but I fortunately have 2 floors. So when I go to the lower level, that's it. You know, I don't take any work down there because I kind of work at my dining room table. So it's sort of in my face and with the main place I live, but I have a separate space to go to. Not everybody has that luxury, you know.
I live in the studio apartment in
So there's
Manhattan.
nowhere to go.
I've actually thought about going back to my office and working remotely from there because I'm able to walk. I don't have to take public transportation.
Oh, that's good.
So I may do that soon.
Yeah, I have some colleagues that prefer to work out of their offices if they're close enough because they just feel like they can leave it there then, you know, and they can have that separation. So if whatever works, you know, it's like experimenting. And some people work the morning at their home and then the afternoons they do it at the office. And I imagine there's so many challenges with families too, you know, with having kids there all the time, and people didn't sign up for that particular family life, you know, usually with all the children and the homeschooling and the partners. And so it's if there's a really healthy family, then that gets amplified. But if there's something that's a crack in the relationships, those get, I think, amplified too. So, you know,
I've
you and
noticed
I
that,
both live alone, so we don't have that
right.
situation.
But I've noticed that with clients who are working remotely and they have children and they don't have childcare, and the children are coming, through and into the session, and just having to make the best of that.
Right, right, right. Well, I'm so appreciate all the work you and your colleagues did with the HIV/AIDS situation, and I can see how that would be so much more painful in certain ways. I mean, they're just challenges. I mean, there's just pros and there's things that you had that you could gather, but we can't gather now, and people are unfortunately passing alone or even if it's whether it's coronavirus or not, and but I wonder if there were some things that you learned that helped your resiliency from that time in coming into this experience, or from 9/11. I mean, 9/11 is a different sort of situation, but also affected people for a long period of time because we had the anthrax threats and things kept going in our country. It wasn't global in a certain way. It wasn't as global.
I think really staying connected to community has helped, and that's where the somatic experiencing community has been so invaluable for me. Really feeling like that's an extended family that I can get support from. And there's a shorthand there, and that I'm still very close with my initial training cohort, and we feel like family at this point, and it's been 20 years.
It's
So
so beautiful. I'm so glad I got to be a part of that a little bit as coming back to teach, but you do have a really beautiful community there. And I got to visit you when I came back a year ago in May, right? So we got to do a little mini reunion.
yeah.
It is I'm so glad you guys stay so connected and are so tight. It's really one of the most beautiful outcomes of the training. The training is excellent material, but that community is priceless.
And just also being able to assist around the country, and just feeling like there's now this national and international community, even if it's only through Facebook or other social media, but really that you can reach out and connect with people who understand what you're going through and are facing some of the similar challenges. And just also one of the legacies that we do have from the HIV epidemic that is just the fast track of how we're seeing possible vaccines and tests. It was because of groups like ACT UP and the Treatment Action Group who, protested and did die-ins and demonstrated to the FDA, because it took years and years and years for things to, move through that pipeline. And so things are so much more expedited now. And the thought of a vaccine, and I guess they're talking optimistically 18 months, was unheard of back then. It just years and years.
And now they have this possibility of, they're calling it convalescent plasma for people that might have antibodies. There's some promise there. And probably a lot of some of this understanding may have come from the journey of trying to understand the AIDS virus. So it's just a.
And Dr. Fauci was at the front lines all during the AIDS epidemic. And I think that's really, informed his ability to cope so effectively with the current crisis.
He's been such a fantastic leader. He's been a really great example of good leadership through all of this. And thank goodness we have him on board. And apparently the leaders in New York are doing quite a good job. Are you feeling good about it?
Very good. Governor
Cuomo
has been so responsive and shown so much strength, but particularly, I think, compassion and empathy that we're not seeing at a federal level, and that he really wants to do what's best for the city and the state, but do it responsibly and safely. And I think people are finding a great deal of solace in the way that he's handled this whole situation.
When I was reading one research study on pandemics, they said one of the most important things is to have strong leadership and like being transparent about what we know, what we don't know, explaining the necessity for quarantine, and also the leaders that help people understand that when they're in quarantine or sequestered, they're actually saving potentially their life, but it's altruistic in that they're saving other people's lives. And they said in the research that when people are given a mission to help other people, they are much more willing to make the sacrifices that are needed to stay home and to stay inside and to not be out more than they have to be. And I thought that was a really interesting point about the type of leadership that's needed, and also the altruism that comes up when we're in these kind of protracted crises. And I think you're seeing that in your leadership there. And Viktor Frankl talked about, he was, of course, the man that wrote Man's Search for Meaning, and I think almost everybody's read that book. It's one of my favorite books. But he said that what he witnessed in the concentration camps was people could, when they're in such a horrible situation, and they, again, survival part of themselves, that people tended to operate in two different types of groups, either moving a little bit more or a lot towards self-centeredness, and like you kind of might see that with the hoarding activity that sometimes people get stimulated to do, or really trying to help each other, like really banding together and trying to help each other. And I think we're seeing a lot of banding together. I mean, there certainly are examples of people doing kind of greed oriented things, or putting their needs way ahead of other people's. But I think a lot of really inspiring things that people can step up and they can come up with great ideas, like Jen did with the therapy support, which is amazing. I'm so glad you talked about that, and that everybody listening can take advantage of that as they need to. Just beautiful things, that creativity and innovation are also coming out of this, as well as all the other difficult things. And I know I'm not trying to gloss over the difficult things, because people are suffering immensely without having income, and it's slow to get money to survive and keep their basic needs met. And like you mentioned, the homeless population, and certainly the African American population is really taking a hit. There's bearing the brunt of a large number of the deaths, and there's different reasons for that. They think because of some of the pre-existing conditions, that sometimes different populations are subject to different illnesses, and also that they often don't have the safest living quarters. And a lot of times there's multi-generations living in small spaces that might make it harder to contain the virus. And also the economic gap, the wealth gap that many people experience from an African American experience. So I just wonder if if there's anything you'd like to add about just the disparity and the issues of diversity with this pandemic. That's always a problem. And just like I said, it was an affect amplifier when a relationship has trouble. This is like a tragedy amplifier for those groups.
Well, I think it really does underscore the disparities in access to health care in our country. That people who historically have not had access are the ones who are suffering the most during this now, and that was true of the HIV epidemic as well.
So it just keeps going on. I mean, I have this sincere desire that we learn some really important lessons from this as a society, and that we can start to vote and get legislation that actually is much more supportive. And I'm an optimist, but I'm also a realist. And I know these issues they're not new. The pandemic is just amplifying it. But I'm hoping that with that awareness, we don't tolerate so much disparity, that somehow we can figure out ways to legislate or to take action, and not just talk about it, but actually, like Jen did, creating this thing overnight for therapy support. I certainly don't have the answers for that, but I really, that's one of my wishes, because sometimes out of trauma, insight and creativity also come. So I'm really hoping that together we figure out some ways to work with some of these things that have been ongoing. A pandemic's in their own right, to say it in a weird way, that these injustices that have been going on for so long. I know you teach this topic, so anything you'd like to share with us would be great.
Well, I think just looking at it not as maybe an individual or a small community thing, but on an institutional level, and really addressing institutionalized racism.
Yes.
Which,
well, that's what we're really seeing is the institutionalized or structuralized racism in action, right? Without medical needs being met.
All these inequities.
Yes.
And yes. I saw earlier on the news today that no one in Puerto Rico has received a stimulus check yet. So, and we know how desperate everyone in Puerto Rico was, after the hurricane, and how difficult it was for them to get help and support from the government.
And Katrina too. I mean,
yeah.
We don't have I'm sure it's way more complicated than I can even grasp, but it does seem like an amazing repeating under support that just keeps happening. So is there anything else you'd like to share with us as we kind of come to a close? I'm so glad you made time to talk today.
Well, I just really appreciate having the opportunity. It's always lovely to see you, even if we have to do it virtually. And I'm so glad you're offering this to people.
Yeah. Well, and I just want to invite people, if there's something that they'd like to do a commentary on, they're welcome to check in with me, and you can connect with me through help@dianepoolheller.com. But I'm so grateful to Jen for putting the therapy support network organization together, and she's another Colorado person. And hopefully we'll get you out here in Colorado when it's possible with the move. Given a pandemic, it's not the easiest time to make a transition, but just if there's any way I can help you personally, I'm here.
I do. Thank you, Diane.
Okay. Well, thanks, Scott. Have a wonderful rest of your day. And I really appreciate you making some time to talk to all of us. It's really been valuable to me personally, and I think to everybody listening.
I hope so. Thank you.
Okay. Bye for now. Take care.